Hello and welcome. Today we have a special treat. We have Dr. Aakanksha Singh and Dr. Nidhi Gupta with us. We'll be talking about nomophobia, digital freedom, and so many different things in a very short span of time. So welcome both of you.
Thank you, Dr. Kashyap. Thank you, Dr. Singh. It is a pleasure to be here today.
Likewise, Dr. Nidhi and Dr. Kashyap, very excited.
All right. So our audience may not know you, at least in our sphere. So please introduce yourself. I'll go with you, Dr. Singh. Dr. Singh, can you please introduce yourself to our audience?
Sure. Hello, everyone. I am Dr. Aakanksha Singh, and I'm a psychiatrist from Mumbai, India. And I'm currently studying for my USMLE boards so that I can build a career in USA as a psychiatrist. And that's a little bit about me. How about Dr. Nidhi?
Absolutely. I'm a pediatric endocrinologist in Franklin, Tennessee. I'm also a digital wellness coach. I'm the founder and CEO of Phreedom, Ungrip Devices, Grip Life, which is a platform to raise awareness about smartphone addiction and to enlighten my students to reclaim their time and attention in this technology-driven economy.
Fantastic. It is very thrilling to have you both here today. Dr. Singh, we know that you're leading a major global study, cross-section study. Can you tell a little bit about that study briefly?
Sure. So thanks to GRRSP, that is Global Remote Research Scholars Program, we're conducting a global study, which is also known as the Global 3P study, Providers, Phonelessness, Phobia. So the theme is around nomophobia, which is nothing but no mobile phone phobia. And we're conducting it since 1st of April. And we nearly have more than 10,500 responses and more than 131 countries are participating.
Fantastic. And how did you come about the study? What was your idea behind doing something like that?
So when I was in my residency, I came across a paper and we didn't know that there is something called nomophobia because it's not listed in DSM-5 or ICD-10. But there were so many recent articles about medical students having nomophobia. And then I just got curious and I looked it up, and I also found a validated nomophobia questionnaire scale. So this was ideas, and I brought it up, and my mentor about it, and he said, let's do it on a global scale, and let's target 10,000 responses. So that's how we decided to go ahead with it. We validated the questionnaire into a modified one and removed about 6 questions and added few more, including about habits, like how we use our phone during our driving or daily, like immediately after waking up from bed, or using it before going to bed. So I think that is what Dr. Nidhi is also emphasizing a lot through her Phreedom.
Dr. Gupta, so I think the audience may not know, and then those who are watching today should go and watch the TEDx talk given by Dr. Gupta, and then your publication as well. So can you share your experience in this space? You have become a big champion of the digital freedom and things around it as well. So please go ahead.
In my research, what I found was excessive use of wireless mobile devices affects 4 major areas of health. And I call them wireless mobile devices because they are wireless, because they use wireless internet to send and receive data. They are mobile. I don't call them smartphones or smartwatches or smart tablets. I think we give them way too much respect by calling them smart. We need to put technology where it belongs. So the 4 major areas of health that are affected by excessive use of wireless mobile devices are number 1, obesity, number 2, sleep, number 3, mental health, and number 4, distracted driving. We have more and more data in the last 5 to 6 years that confirms our suspicion that all of these 4 quadrants of health are negatively impacted by excessive use of our devices throughout the day. I published a research article last year focused on the pitfalls of excessive use of wireless mobile devices by healthcare professionals and how that might be associated with distraction, procrastination, errors, and burnout. Now, you might already know this, you might be familiar with this, but an average person checks their phone about 96 to 206 times per day, which is every 5 to 6 minutes of their waking time. There is solid evidence that shows that every time we are distracted by a notification, it takes us about 19 to 25 minutes to reorient our attention back to the task that we were doing. So can you imagine how much time is being wasted by distraction when we check our phone about 200 times a day? The math just is mind-boggling and is bound to have a lot of negative effect on productivity, efficiency, and clinical errors when devices are used by healthcare professionals.
Well said. Actually, that's the exact reason I turned off all my alerts 4 years ago, and the life has not been better than that. So I'm so glad that you were talking about data behind it, and there's number around it as well. The question comes in, I think, and I would like Dr. Gupta you to answer as well. As the use of technology is increasing, the artificial intelligence now with large language models and things like that as well, how you see ourselves making that balance of not only being aware of what you guys are fighting for or you are looking into, and at the same time not lagging behind in technology and things like that. So first, Dr. Gupta, what would be your answer to that?
So my mission with Phreedom Ungripped Devices Grip Life has been very clear. It is not to give up technology. It is not to throw our smartphones out the window and go back to using a flip phone. I don't think that would be practical. That would just be making our life easier. It is about finding balance between life and technology. And yes, I put life first before technology. So I coined this phrase, life, technology, balance, and I hold it very close to my heart. Now, when we talk about artificial intelligence and the potential that artificial intelligence has in changing our families, changing our work, our efficiency and productivity, there are so many unknowns about AI that it is hard to predict what the future will look like with AI. And quite honestly, artificial intelligence has been around for over a decade now, but it has been around in a more subtle manner. We did not notice that it was there. Now it's right in our faces, right in social media. We are excited about all the good things that AI has to offer. It can help us write blog articles. It can create nice social media posts, business strategies, research articles, maybe even used for cheating, writing school essays and things like that. What we don't know is the harm that AI is capable of, and that unknown bothers me. No one seems to talk about the downsides of AI and what we need to be careful about before bringing AI into our life with full force.
Dr. Singh, can you answer the same question as a behavioral health expert, that how to make a balance?
So what I believe is, like Dr. Nidhi rightly explained, that we have to strike a balance, and having that balance is very important, especially for your mental health as well as your physical health. And when we have that both, we're able to be more productive. And we have to learn that, like Dr. Nidhi always explains, that we don't control, let mobiles not control our lives. We should have a control over them. And nearly with just 24 hours in our hand, how do we utilize that perfectly for our productivity, our sleep, our time with family, as well as physical health? So just focusing on the balance, and that's what digitally wireless mobile devices or even AI is taking away from us.
Well said. I know that the results are not available right now with Global 3P study, and when they become available, we're going to bring you back here to talk about them as well. But you have spent time either with the kids or your own personal life, having young kids and things like that as well. How you see that it may be even a bigger problem or maybe a lesser problem in the young generation. I remember all of you are younger than me, but I remember when we growing up, we didn't have to worry about this part. Television was limited as well, but now the kids are learning to eat after they are learning to drive a mobile phone. So any thoughts on that, Dr. Gupta, that how we should be worried about and what can we do to negate some of these upcoming challenges?
What we know from research, Dr. Kashyap, is that an average 13 to 16-year-old adolescent in the US and in several other countries is spending about 5 to 7 hours on their devices outside of schoolwork. So it is primarily entertainment, discretionary leisure time that is being spent doom scrolling the internet. Generally, around age 13 to 14 years is when major brain changes are happening in the frontal cortex, and that is the age that is typically related to decreased self-control. So it has now been determined that the addiction to wireless mobile devices is higher in those whose age at first smartphone was less than 13 years of age. We are noticing an increased trend where the younger generation is struggling with communication skills, is struggling with learning, memorizing, and a lot of day-to-day activities which used to be very normal, because a lot of time for them and for their parents is spent not looking and communicating and engaging with each other, but engaging with the devices. One of the questions that I'm often asked about is, what is the right age to introduce a child to a smartphone? There is this campaign called Wait Till 8, which means wait till the child is in 8th grade. It's a good start, but waiting until 8th grade might not be one size fits all. I don't think all children will be ready to handle a smartphone as soon as they are in 8th grade. So for parents, when you decide to give your child a smartphone, there are a few things to consider. Is your child's temperament in general aggressive? Do they lack self-motivation? Do they have self-discipline? Do they have impulse control? If a child struggles in these areas even before they have been handed over a wireless mobile devices, then all of these characteristics are going to get worse.
Absolutely. I think that you well put. Dr. Singh, coming back to the study, you are trying to raise an awareness among healthcare providers, the doctors, the nurses, the PharmDs, and so on and so forth. And the study's title is Global 3P, Global Providers Phonelessness Phobia or Nomophobia. Can you tell a little bit more about the term nomophobia, because it's no mobile phone phobia? Should we be concerned as a healthcare provider that how much reliance we have on these phones, maybe for personal use or maybe work-related things, because the alerts and paging and then patient charts and all those things. So any insights from you while designing the study, what has been your learning so far?
So what we found, go ahead, Aakanksha, go ahead. Sorry.
Definitely, Dr. Kashyap. So, as we all know, that being physicians as well as students, most of us get notifications about just patient data as well, your investigations. Even if we have to look up about some new medicine or some new information, we are always going to our phones. So, nomophobia is exactly no mobile phone phobia. That means you feel anxious, you feel worried, and you feel that you will not be able to be functional without your mobile phone. And that's precisely, even though it's a type of a phobia, but it is actually stimulating your dopamine and it is going on the pathway to digital addiction. Now, definitely, we cannot comment that it will hamper patient care or it may decrease your quality of care, but definitely it will distract you and you might not be able to make the right decision. As Dr. Nidhi was mentioning, that if you get a notification and you check, it takes you nearly 15 to 20 minutes to come back and be totally focused. So as physicians, as healthcare providers, we really need to pay attention to our patients' needs. So I think definitely, we cannot function without a mobile phone, as most of the hospitals are moving from pagers to their mobile devices. So that could be again good. But again, I think there should be some kind of restrictions as to maybe 2 to 3 hours of work time and probably 2 to 3 hours for personal phone usage.
So there was a cross-sectional survey of residents and faculty at a teaching hospital in New York. It showed that wireless mobile devices were being used during rounds in inpatient setting to read and respond to personal texts and emails by about 37% residents and 12% faculty members. and there were other non-patient care uses of devices during rounds. There was one specific case that was published in Lancet that described that on rounds, a resident had to enter an important order where she had to discontinue an anticoagulant. When she reached for her phone to access the electronic medical record on her phone and discontinue the order, on the home screen, there was notification about dinner plans for that night from her friends. So she got distracted by the message and took the time to answer the message, and in that process forgot to discontinue the anticoagulation order. Unfortunately, 3 days later, it led to a life-threatening clinical complication for the patient. So there are some serious implications of distraction that we need to be very mindful of when it comes to wireless mobile device use while working in a healthcare setting.
Multitasking is a myth when it comes to using your mobile devices and so on and so forth. So this has been fascinating. I would like to thank you both. Any concluding remarks from you, Dr. Singh, followed by Dr. Gupta? What do you like to know your audience who are watching this video today?
So I would like my audience and my listeners to know that, like Dr. Kashyap mentioned, that multitasking is actually a myth. We should all try to be mindful. That is, when we're doing one task, try to be 100% focused on that and then try to move on. Nomophobia is actually a real thing, and we should really start thinking about the choices. What kind of applications we have on a mobile phone? Are they important for us study, or maybe are they important for our work? And if it's not needed, we must really delete it and be able to filter out the mobile applications, as well as some things like, your Twitter, your LinkedIn, your Instagram could be probably accessed directly from your laptop or your iPad, but not probably from your iPhone or your Android devices, so that you're not distracted while you're at work, while you're studying, or while you're driving. So just think about striking a balance, and nomophobia is a real thing.
I agree with you 100%, Dr. Singh, that some of the strategies that you outlined are exactly what I talk about in my digital wellness coaching program. Wireless mobile devices are definitely a source of distraction, errors, procrastination, and burnout. And before we know it, excessive use of these devices can lead to a diminished sense of well-being and a burnout. So balance and moderation are the key points in facilitating life technology balance. As healthcare professionals, we take care of other people, we heal other people. We have to take the time to heal ourselves. We have to aspire to our own mindfulness, our own engagement and well-being, rather than distraction and procrastination.
You said procrastination. I think we should have another video or interview just for that part, how mobile devices are causing and contributing to procrastination, and I'm a biggest champion of procrastination as well. Well, I think this is the time we have today. Thank you so much for both of you for being here today and talking about it, bringing a little bit of a limelight on this particular topic. I'm sure we're going to bring you back a couple of times once the manuscripts are published, and then we have some topics like procrastination and then mobile health devices in this regard. Really appreciate your time today.
Thank you for having me on the show, Dr. Kashyap.